Okay, welcome everybody. My name is Andrea Rodriguez, and thank you, Penny, for a beautiful introduction. So I have been educating on Medicare for 16 years, and it's a confusing subject, so I'm hoping to clear it up with everybody today. The presentation is educational, and it's to help you to understand the A, B, C, and D of Medicare, and really what's the main differences between a supplement plan and an Advantage plan. I think I'm pretty good at projecting my voice, and I walk around if I'm not by the microphone.
But if we're filming it, it's very helpful to have the microphone whenever you can.
Okay, perfect. So I'm going to do my best to stay behind here and use the microphone. So the presentation, I'm going to just make sure I'm set up. So it's the top 10 questions of Medicare. The presentation really is geared for people that do not have employer coverage. And you're going to see commercials every 30 seconds about now's the time to make a choice. We're in open enrollment, zero this, free that, dental, eyeglasses, are you in the right plan? You're going to be bombarded until December 7th. So the open enrollment is October 15th to December 7th. The presentation, the full booklet is by the door when you're walking out. I try not to hand it out because everyone's shuffling through the book, when really the two main things I want to go over, everyone should have on their chair, the two main pages. And if you don't, they're printing out more because I had a presentation this afternoon and we had a lot more people walk in than signed up. So when you're leaving, help yourself to the blue books, and she's going to come in with the second page if you're missing the A and B of Medicare. So. Because that's what I really like to go over is, really the differences between the two plans. But today we're going to learn what Medicare is, who can get Medicare, what does it cover, how much does Medicare cost, where can I get more coverage, how do I choose, when can I enroll, when can I change my coverage, and how can I save more money, and more importantly, where can you go for help. So these are, the top questions that we'll be reviewing today. And I'm sure most of you know what Medicare is, but it's part of the presentation. So I'll go through it. It's a federal health insurance program that's for United States citizens that have lived in the United States 5 consecutive years or more. It's funded by your taxes, and you pay for it while you're working. And it's an individual health insurance. What it's not is a family health plan. So it is individual, it's not Social Security, Medicaid, and it's not free. If you don't have the form that says Part A and Part B, raise your hand, and she just came in with some. And she'll hand out the second page. Everyone should have 2 pages for this presentation. Perfect.
Can I have? Yeah.
I'm just getting used to my mouse here. So who could get Medicare? I'm sorry, I'm just getting, okay. So that's your Medicare card. Everyone knows, because this is old news, that they did get new Medicare cards. We no longer have your Social Security number on it. And as I said, you need to be consecutive at least 5 years in a row working in the United States to apply for Medicare. And you could apply when you're 65. If you're under 65, you still could apply if you have a disability and if you have end-stage renal disease. So what does Medicare cover? So I am going to go over in detail. And again, it's part of my handout because a lot of people get the Medicare book and they don't read it, which is a huge problem, why people make a lot of mistakes. So this one form explains in detail Medicare Part A and Medicare Part B, because Medicare, as we know, has two parts, Part A and Part B. And again, these are the 2019 costs and co-payments and co-insurances. Medicare has not announced their 2020 numbers yet. We're waiting for them. So Medicare Part A, as it shows on this take home, is for your hospitalization. And it includes everything while you're in the hospital. It also is your skilled nursing services, some blood transfusion, hospice, your lab work, everything while in the hospital, your operating room, recovery. So everything under Part A is hospitalization. Some facts about Medicare Part A is it's free. Your premiums are free if you or your spouse worked and paid taxes for 10 years or longer. It can't be denied, so you can't be denied coverage. You can go to any hospital and any doctor that's affiliated with Medicare when you have your original Medicare A and B. The coverage is nationwide, including any qualified hospital, and the coverage and costs are per benefit period. You must be admitted as an inpatient for it to fall under Part A, and it has additional lifetime reserve days, which I'll get into in my presentation. So Part A is all of your hospitalization, and it's free. Part B is all of your physicians. It's anytime you see a doctor, it falls under Part B. Your annual wellness visit, your clinical lab services, any x-rays, MRIs, CAT scans, health programs like how to quit smoking, all your therapy, physical therapy, occupational therapy, all of that falls under Medicare Part B. Diabetes screenings, mental health care, any medical equipment, ambulatory surgery, and an ambulance also falls under Medicare Part B. So Medicare Part B is not free. Medicare Part B has a monthly premium. This year, your monthly premium was $135.50. They haven't announced what it's going to be next year. And your Medicare Part B premium, along with your Medicare Part D premium, is based on your income. So everyone who wants Medicare Part B will pay $135.50 to start. And I do have the chart if, at the end of the presentation, if you want to just look, it is based on your income. Oh, this my mic just died. All right, mic is dead. Let's see. We're back up? Okay. So Medicare Part B, again, $135.50. If you file joint and you file over $170, then your income is over $170,000, then you'll pay more for Medicare Part B. So it goes from $135.50 up to $460.50 a month, depending on, all right, I'm skipping that, depending on your income. So if your income is low, then and under 170 if you file joint, or if you file single, if you're under 85,000, you're going to pay $135.50. And anything higher, then you'll see that the cost goes up. It's called an income-related, the mic keeps dying, Penny, so I'm giving up on it. So you can't be denied coverage when you have original Medicare. The coverage is nationwide, and there is a premium penalty if you enroll late. So this is when people make mistakes. They leave their employer coverage and they don't pick up Medicare Part B, or they pick up COBRA and they think COBRA is credible coverage, so they don't get Part B. But if you have COBRA, you still need to enroll in Medicare Part B. And I will tell you when you can enroll in Part B during the presentation. But you do want to enroll when you're walking away from your employer coverage. You want to make sure you have A and B, and when you're turning 65, if you do not have employer coverage, you want to make sure you have Medicare Part A and Part B. So Medicare doesn't cover everything. So the top of this chart is original Medicare, A and B. Some people only carry original Medicare, the Medicare card A and B, and what it does not cover is you'll have all the cost of your care. So you're going to have to pay the 20%, and you have an out-of-pocket cost with no limit. So that's when I meet people and they say, I only have original Medicare. I say, be very careful, because there's no ceiling. You're going to pay 20% of whatever life throws at you, whatever your hospital bill is. So you want to pick up a supplement or an Advantage plan because original Medicare has no limit to what your out-of-pocket costs could be. Original Medicare does not cover prescription drugs. You need to get that in addition to your A and B. It also doesn't cover routine dental, vision, or hearing care. You won't get eyeglasses or hearing aids on original Medicare, and you won't get long-term care. So you won't get a nursing home or help with bathing, eating, or dressing. That you would need a long-term care plan for that. Excessive charges for services by doctors who don't accept Medicare assignment won't be covered under Medicare. And care outside of the United States, Medicare doesn't cover. So how much does Medicare cost? So you'll see these, and you'll hear them while I'm talking through the presentation. It just keeps dying out.
we're getting new batteries, so I'm sorry.
Oh, okay, I'm just gonna keep going then.
Yeah.
Okay, so premium is just, these are just words that I'll be saying, I wanna make sure you have an understanding of them. Premium is a fixed amount, so your monthly premium, when you usually, when you have an Advantage plan, they have a monthly premium, it's a fixed amount. A deductible is what you have to pay out before the coverage starts, before anything starts going into effect and you get any service. A deductible is a set amount you pay out. A copayment is a fixed amount, usually like a $20 copayment or a $40 copayment. And coinsurance is a percentage. So they'll tell you you have a copayment of $20 or a coinsurance of 20%. A coinsurance of 20% is whatever the bill is, you're paying 20% out of pocket. So those are 4 terms I like to everyone to know. Again, these are your costs for Medicare Part A in detail. So if you only had original Medicare and you went into the hospital, as soon as they admit you, you're responsible for $1,364. That is a benefit period. It's not an annual deductible. So if you come home and you're home for 60 days and you go back into the hospital on day 61, even if it is the same condition, you have to pay the $1,364 again. So that's a reoccurring deductible. If you stay in the hospital longer than 60 days, on day 61, Medicare is going to charge $341 a day. When you're in the hospital 90 days, your bill would be $10,230. If you're still in the hospital 91 to 150 days, Medicare jumps to $682 a day, and you would have a $40,000 bill. So, and it happens, we never know when life's gonna happen, so that's what, just if you had nothing but original Medicare, you can incur expenses. So Part B, we all know this year it's $135.50, so everybody has to have Part B if you want to join a supplement plan or an Advantage plan. So it's $135.50, that's, for most people, that's the starting cost of it. And then when you first go to the doctor, if you only have original Medicare, you have to pay the first $185. That is called your Medicare Part B deductible. Once you're out of pocket, $185, it usually takes 2 doctor visits to hit that. Then Medicare says, okay, she paid out of pocket $185. Now we got a bill from the next doctor for $500. The approved amount is $100, and that's not an exaggeration. Medicare's approved amount compared to what the doctor billed is significantly less. So the Medicare says the approved amount's $100. Medicare instantly sends the doctor 80%, and you'll get the bill for the 20%. That's if you only have original Medicare. You'll have out-of-pocket expenses for your doctors. Again, there is no out-of-pocket limit. So it's 20% of whatever life throws at you. So where can I get more coverage? So now that we have an understanding of what Medicare Part A and Part B is, hospital and doctors, everybody's here. They're all at the top. Everyone's carrying a Medicare card. If you're not, I will tell you when you can enroll to get one, you know, those who are leaving work or maybe turning 65 during my presentation. But right now, assuming everybody had original Medicare A and B, you have 2 choices at this time. Option 1, is you keep original Medicare. So you're always going to show the doctor that red, white, and blue card, and you'll pick up, in addition to that Medicare card, a supplement and a drug plan. Option 2 is what they call an Advantage plan. If you're not going to keep original Medicare, you're going into privatized insurance. So on this side, it's original Medicare plus a supplement and a drug. On this side, it's an Advantage plan, also called Medicare Part C. So we're going to start with option 2. That's how this presentation goes. So option 2 is a Medicare Advantage plan, also called Medicare Part C. It's another way to get your Medicare benefits. It's an alternative to your A and B card. Plan members are still in the Medicare program, just not on original Medicare. They're with privatized insurance, and the benefits are administered by the plan. And the plans are offered by private insurance companies. So what they do is they give you the benefits of Part A and Part B with an Advantage plan. They build right into it your prescription drug plans. And a lot of times they call it an Advantage plan because they're giving you extra things you wouldn't get on Medicare, such as maybe dental exam or cleanings, x-rays, eyeglasses. You wouldn't get eyeglasses on original Medicare. So these Advantage plans build things like that right into the plan. Hearing aids, some of them have free memberships. So when you have an Advantage plan and you choose option 2, you think that we're up and running? I'm pretty good at talking loud. So when you have an Advantage plan called option 2, Medicare Part C, it's also called an HMO, a PPO, a POS, an SNP. So there's different types of Advantage plans. The 2 I want to explain to you is when you choose option 2, you go into, because these are the most popular in Suffolk County, an HMO or a PPO. An HMO is a health maintenance organization. So you join XYZ Advantage plan, they're going to mail you a book, and they're going to say these are the doctors and the hospitals that are in our network. You can go to any of them, and you'll have a set copayment. If your doctor is not in this book, you cannot go. It will be 100% out of your pocket. That's a health maintenance organization. So we could check, and you could say, these are the 5 doctors, I really want to make sure they're my specialists, I love these doctors, don't want to be without them. I check, I open up the book, and I go, that doctor's in it, perfect. January, you love the plan, it's 0 premium. February, it's wonderful. March, you walk into your doctor's office, and he has a sign, no longer taking XYZ Advantage plan. You sign a 12-month contract for an HMO, but the doctors do not. So I always like to bring that to your attention. You have to be flexible with an HMO. If your doctor or hospital walks away from it, you need to go through the book and find new doctors, or you're going to pay 100% out of pocket. You have on the option 2 a PPO. A PPO is a preferred provider organization. So when you walk in and you see we no longer accept XYZ Advantage plan, you could say, this is a doctor I prefer to see. I still want to come here, and you can. When you have a PPO, you'll just have a higher out-of-pocket expense, but you won't have the whole bill to see that doctor. So if you're looking at option 1 and option 2, and you're thinking I might want to be in an Advantage plan, I do always say look at the PPOs versus the HMOs. So some facts about the Advantage plans is you have to, people go, well, I opted out of original Medicare, so do I have to pay my Part B premium? That's a question I get all the time. You do. No matter what option you pick, you always have to pay Medicare's Part B starting at $135.50. You can't be denied coverage to go into an Advantage plan because of your health status or your financial status. You at any time could go, well, not any time. Now we're in the open enrollment. You have till December 7th to decide if you want to go into an Advantage plan. You may be required to use network. You are. If you're in an HMO, you are required to use the network. You may be with a PPO. And the coverage and costs vary by plan. And it says it may change, it does. Every year the whole game changes when you're in option 2. Doctors move in and out of it, co-payments, premiums, sometimes they offer dental and they take dental away. So the whole game changes. You want to make sure when you're in option 2, you really read the summary of benefits that they mail you, because every year it does change. The advantage also is these have an annual limit on your out-of-pocket costs. So this year in Suffolk County, if you are on option 2 in an Advantage plan, your maximum out-of-pocket is $6,700. If by any chance with paying hospital co-payments or you went into a skilled nursing facility, if you hit $6,700, then the plan kicks in and pays everything. So that's in network. Out of network, if you were in a PPO and you said, well, I want to go to like Sloan Kettering only takes original Medicare. So if you go, I want to go to Sloan Kettering, you can with a PPO, but your maximum out of pocket in Suffolk County is $10,000. You may be charged a monthly plan premium. There are Advantage plans that are 0 premium and they go up to $300 a month, and you must continue to pay Part B premium. So you have to pay that $135.50. So now I want to explain the Medicare Part D, because you'll notice on both sides Medicare has Part D. So you could choose it to get it as a standalone in option 1, or you could choose it to get it already built in to your Advantage plan in option 2. But plans are offered by private insurance companies. So it's not part of original Medicare. You're not purchasing it from Medicare. It is privatized insurance for your drugs. And the type of drugs most commonly prescribed for Medicare beneficiaries fall under Medicare Part D. And they have brand names and generic drugs, and they put it, each drug company sets up a formulary of, these are the drugs we're going to carry, and this is how we're going to tier them. And you'll see the way that they're tiered, tier 1 being the least expensive, tier 5 being the most expensive. So now you have 35 drug companies, and everyone's offering the same prescriptions, but they're allowed to group them and tier them at their own, however they want to do it. So everyone in here could be on the same prescription, and some could be in a company that tiers it as tier 2, some could be in a company tier 1, some in company tier 3. So you not only want to check that your prescriptions are covered by your drug company, you want to make sure that they're tiered the lowest. And in general, the lower the tier, the lower the cost. And this year, there's only 2 drug plans that will have no deductible. The common deductible for 2020 is $435 out of pocket before your name brand drugs will be covered. If you're on generic drugs, tier 1 and tier 2, the deductible doesn't apply to just about every plan. So when you see a deductible built into a drug plan, it's usually on name brand drugs. And I would like to explain the donut hole and how that works. So prescription drug plans have 4 tiers. The first tier is the deductible. $435 is the deductible for 2020. So if you're on a name brand drug, you're going to pay out of pocket the first $435. Once you're out of pocket, then you're going to get a discounted rate, and you're in what they call the initial coverage. So I'm going to use the example of a $1,000 drug. You walk into CVS, you already paid out your $435, and the $1,000 inhaler, when you go to pick it up, is $100. So you're now in the initial coverage. You're getting it discounted. It's $100 every time you pick up that inhaler. But Medicare is not counting the $100 coming out of your pocket. They're counting that the inhaler was $1,000. So every time you walk into the pharmacy, Medicare is going $1,000, $2,000, $3,000. When you are out of pocket, and again, these are the 2019 numbers. The 2020 numbers I just got, so I'll tell you what they are. When you're out of pocket, $4,020, so that went up a little bit. Medicare says, okay, she only paid $400 at the pharmacy, but we've paid out the $4,000. The full cost of the drugs was $4,000. You are now in the coverage gap, also called the donut hole. You walk into CVS, you don't even know you're there, nobody gives you any warning, you've got your $100 in your pocket to pick up your prescription, and they go, today that will be $250. When you're in the donut hole, you're paying 25% for the cost of the drug. Every time you pay $250, Medicare, when you're in the donut hole, is no longer going $1,000, $2,000, $3,000. They're only counting what comes out of your pocket. So now they're going $250, she spent $500, she picked it up again, $750. When you alone are out of your pocket, $6,350 is the 2020 number.
Andrea, excuse me, is that for just one drug?
No, that's a combination of all your drugs. That's your number for the whole year, whether you're on one drug, 20 drugs. So when you're out of pocket, the $6,000, you fall into what they call catastrophic coverage. And you'll go to pick up the prescription again, and they'll say today it's 5% of the cost. Usually, when you're at catastrophic, you're at the end of the year, and then January, the whole thing resets itself. So for anybody who falls into that and they say, I'm hitting thousands, I'm on a lot of expensive prescriptions, you do have assistance in Suffolk County. It's called Epic. And people go, oh, I know Epic, my mother was on Epic, you have to be like destitute, like you have to have zero money. No longer, they raise the bar. The Epic application helps with people who are falling into the donut hole, and the household income has to be under $100,000 if you file joint, under $75,000 if you file single. So if you find that you're running into a lot of out-of-pocket expenses, please ask to pick up the application for Epic. It's free and offered in New York. And I have applications with me today. So that's the donut hole. And that's whether you're in option 1 or option 2, that's how you fall into the donut hole. When you're on expensive prescriptions, you're going to fall into the donut hole. So some facts about Medicare Part D. In order to get a drug plan, you need to be enrolled in Part A or Part B. You may be required to use pharmacy networks. I always say call when you decide on a drug plan and ask them, what is the preferred pharmacy? Because you could be walking into Rite Aid because it's around the corner and spending $20 and not knowing, had you gone into CVS, all of that would have been $1. And it's the difference of where you pick up your prescriptions is really enormous. So you always want to find out who's your preferred pharmacy with the drug plan that you pick. And the coverage and the cost, it varies by plan, and it says it may change. The whole game changes every year. The whole thing changes. If you do not enroll in a drug plan when you first become eligible for Medicare or leave an employer plan, you will get a penalty. So people go, and I see it all the time, I'm on no prescriptions, so I never joined a drug plan. When you do need a prescription and you do decide to join a drug plan, the penalty is 1% per month that you waited to join. So every year that you had Medicare and you didn't pick up a drug plan, you'll get a 12% penalty. And the penalty is not a one-time, slap on the wrist. It's for the rest of your life. You will always pay 12%, 24% more than all of your neighbors for exactly the same plan because you didn't enroll when you were supposed to enroll. And the drug plans this year start at $13. And I advise you, even if you're not on prescriptions, just to avoid a penalty, get involved in a drug plan. You know, again, the premium is as low as $13. So another thing is I just keep talking, so if anyone has a specific question, just stop me. But where we're at right now is I explained what original Medicare was, the A and B, and that we have two choices. Option 2 is walking away from original Medicare, and now I'd like to explain option 1, which is keeping original Medicare and picking up a supplement plan. So the supplement plan is called, also called a Medigap plan. You'll hear it called a supplement or a Medigap, and it helps pay the costs that are not paid by Medicare. And you would need to have Medicare Part A and Part B, and it cannot be used with an Advantage plan. You have to choose option 1 or option 2. You can't have both. And there's 10 plans of supplement plans, and they're offered by private insurance companies. So let me just see if this, okay, so the supplement insurance plans, it helps pay the A and B deductibles, the co-pays, the co-insurances. So really, anywhere that you have an expense on original Medicare, you purchase a supplement plan to help pick up the expense of original Medicare. So you'll look at these charts, and these are the different plans that are offered, and it's Plan A to Plan N. You would think it would make sense that the least comprehensive would be Plan A and the most comprehensive would be Plan N, but it doesn't make sense. The most comprehensive plan is F, the one right in the middle. And you'll notice it covers 100% of everything. So you'll see that on the charts, it has Plan F pays the Part A deductible 100%. So if you went into the hospital and Medicare billed out $1,364, if the supplement plan shows that it's going to cover that Part A deductible 100%, then you won't ever have to pay a hospital deductible. Then there's your Part B deductible. So only 2 plans are going to pay the Part B deductible. And your Part B deductible this year was $185. And that is Plan C and Plan F. Anybody who is aging into Medicare for 2020 will not be allowed to purchase those 2 plans. They're discontinued. You will no longer be able to purchase a plan that covers all of Medicare's expenses 100%. If you already have Part A and Part B, you're grandfathered in, at any time you can purchase those plans. But because no one is aging into it, as people age out of it, they anticipate the premiums are going to be very high. So the big plan this year that everybody is covering is the Plan G, because it covers everything as the F except that one thing, that Part B deductible, that's $185. So, and one other thing I want to point out is that there's an F high deductible plan, and it's the only plan that offers this. You pay a lower monthly premium, and you say, I'll pay all of the expenses of Medicare, and if you hit, the deductible is $2,300. If ever in a calendar year you hit $2,300, going to any doctor, any hospital with this F high deductible plan, everything's covered 100%. So that's another very popular supplement plan because it covers everything with your maximum exposure of $2,300. Yes?
Is the one with the $5,000?
Yes. So the $5,000 one is K, and you pay 50%, and you're out of pocket $5,560. So the $2,000, the F high deductible isn't on this chart because United Healthcare doesn't offer that plan, but it is offered in Suffolk County. It's $2,300 is your maximum exposure, paying 20% of the bills. So a Medicare supplement insurance plan, you have to, again, be enrolled in A and B. There's no medical underwriting. So even if you go, I have scheduled surgeries, for January, and I'm very sick, diagnosed with XYZ, you cannot be denied original Medicare on a supplement plan. In New York, you have no medical underwriting. It's nationwide coverage, and you'll notice that the plans offer, oh, they don't show it on this chart. Okay, the plans offer foreign travel. So even if you're out of the country with a supplement plan, you have $50,000 worth of coverage. They're guaranteed renewable. So even though people might purchase Plan F this year or F high deductible, even if they leave and they are no longer offering these supplements, you will be grandfathered into it and guaranteed the plans for the rest of your life. And the coverage stays identical. So whatever you purchase with a supplement plan, the benefits stay exact until you decide to leave the plan or age out of the plan. So it's guaranteed renewable, yes.
What about the premium on that's not guaranteed?
No, premiums are not guaranteed on anything, and your premiums are as low as the F high deductible is $69 a month, and the F with no deductible this year is $308. So just to give you an idea of the scale of, 69, and you say, I'll be willing to pay the $2,300, God forbid, up to $308, and you never see a bill. So the plans may vary, even for the same coverage, and that's another interesting point. Everybody here could have Plan N or Plan G, and every company that offers it, even though you all have exactly the same benefits, every company could put a different price on it. So more often than not, I meet someone who says, I've had G, I've had it for 10 years, I don't even know what I'm paying. When I say go home and look at what you're paying, because it automatically comes out and people just stop paying attention, more often than not, there's a plan that came in offering the same benefits at a lower premium. So even though you pick a letter and you love the letter that you picked, you want to make sure that you're in the company that's offering it at the lowest premium.
Is there any clearinghouse for the companies so you can do a comparison, or do you have to
No,
follow each individual?
you have to, I am an agent with every company, and for me to say I know all of my numbers, I get relicensed every year with every company, so I know everyone's numbers, but it's close to impossible to find out who's offering what. By all means, if you want, call me and I'll tell you who's offering it this year, in Suffolk County for the lowest premium. I don't have my contact information on anything. This is an educational presentation, but of course, by all means, if you want to reach out to me at the end of the presentation, request a business card. I have them with me somewhere, and then I could assist you in saying, who's offering it at what prices. Again, you must continue to pay Medicare Part B to get a supplement. Did you have a question, sir?
Once you choose 1 over 2 or 2 over 1, can you change that every year?
That's a great question. So if you went into option 2 and you opted out of original Medicare and you have an HMO or a PPO, right now is when you could say, I want to go back into original Medicare and go into option 1. You have from October 15th to December 7th to change if you're in option 1 or option 2 and to change it around. So come December 8th, whatever you chose, that's it. You're in it for the calendar year. It caused a lot of stress for people who, for the first time, left original Medicare and went into an Advantage plan, and then come February, they realized they made a mistake. So this year, they allowed, for the first time, January, February, and March to say, I want out and I want to go back into original Medicare. So the month of January, you would have it if you didn't do anything by December 7th. And then if you called in January and said, no, I want to go back to original Medicare, it would start February 1st. If you called in March, it would start April 1st. After March, that's it. You're in option 2 for the full year. You can't switch. If you picked in option 1 and you said, you know what, I'm feeling healthy, I'm gonna try the F-high deductible plan, you know, the $69 plan, I'm gonna pick that supplement. And you have it for January and February, and then you decide, I feel like it might not be enough coverage, I want more coverage, I'm having a hospital or whatever, and you want more coverage. When you pick a supplement plan, you could change your supplement plan any time in the year, and it will start the first of the following month. So you're locked into an Advantage plan and into your drug plan until the open enrollment of October 15th to December 7th, but not your supplement plan, not the letters that you pick. Yes, sir.
If you turn 65 in the year, let's just say May of 2020,
Yeah?
do you have to make an election during this enrollment period, or you're allowed to do it during
No,
the year?
yeah, so when you age in, you have 3 months before your birthday, the month of your birthday, and 3 months after to say, this is what I want to do, and when you want it to go into effect. Yes?
Is there a profile of a person that we better or beneficial to do option 2 versus option 1?
No, it depends. Most people that go into option 2 say, I'm healthy, I don't anticipate a lot of expenses or hospital stays. I want the 0 premium and the extras, and I'm willing to pay the $6,700, God forbid anything, because I don't even anticipate me seeing a hospital. So most of the people that I meet that say, you know what, this is what I want to do, I want to go into this Advantage plan, really have not been diagnosed with anything, and they're feeling really healthy, and you know, they're good without anticipating any surgery. And I do see that people that stay with a supplement plan and go into option 1 travel a lot. So they like, if I wake up and I'm in California and then I'm flying to North Carolina, I don't want to ask who's in the network. I want something that's going to travel with me, and then I would say go with option 1, because you don't need any referrals. You can go to any doctor, any hospital in the United States. So if you do, you know, anticipate a lot of travel, most people are happy traveling with original Medicare. So how do you choose? This chart can't make it even more confusing, so I'm not even going to go into it. Some things with Medicare, it's just they make it more complicated than it has to be. So that's why I love this chart. It's that simple. You have original Medicare. You have to pay Medicare Part B no matter what you pick. And then you have 2 choices. Do you want to stay with original Medicare, pick up a supplement and a drug plan, or do you want to opt out of original Medicare, go into privatized insurance, and pick up an Advantage plan that offers everything? And people love the Advantage plan because it's one card. You go to the doctor with the card, you go to the hospital with the card, you go to the drugstore with the card, it's all on one. If you were in option 1, you have your original Medicare and a supplement card, and then you have a 3rd card for your prescription drug plan.
When does the penalty start on the drug?
The penalty starts if you left employer coverage and you didn't pick up a drug plan for 63 days, or you turned 65 and didn't have a drug plan for 63 days. So if you have an employer plan, you will not get a penalty because you went right from an employer plan into Medicare. So anybody with an employer plan has credible coverage, and these penalties will not apply to you. If you're a veteran, none of these penalties apply to you. You are excused from Medicare's penalties. But that's really the only way you will not get a penalty. I have tried and said, listen, this person made a mistake, they were in the hospital, they were caring for someone sick, like how could you charge them a penalty? They didn't know they had to join a drug plan. Like, we have tried everything, and Medicare does not care. The penalty is the penalty, and it's with you for life unless you're a veteran. Or if you are eligible for LIS, which is low income. Yes?
I was told sometime back through Medicare that my husband should be on one drug plan and I should be on another.
Yes.
Yeah.
Often when you're on original Medicare, everyone in the house is on a different drug plan. It really depends on what prescriptions you're on. Because if you're on all generic, there's a $13 plan that you could then walk into CVS and pick everything up for $1. If you're on inhalers and injectables, more often that $13 plan doesn't work. You need to be in a $30 plan. It really depends on your prescriptions.
And in the last year, my plan gave nothing. So it must have changed. And
So
I
this
didn't realize
year, everybody changed. I can't stress it enough. For the companies, if you do nothing, they are moving you into a higher plan with double the premium, changing the name of your plan, and offering the plan you enrolled in for new members at half the cost. I don't even know how it's legal, but quite a few companies are doubling their premiums if you do not pay attention. It's a phone call to say, I don't want the $60 plan, keep me in the $30 plan. So pay attention to your prescriptions. It's really important, especially this year is the worst I've ever seen. Everyone's premiums doubling, even though they have a new plan that's half the price. That's equivalent to what you had this year. So definitely pay attention to your drug plans this year.
And our local paper had announced it last week,
Yes,
how all the local pharmacies are hurting.
I know.
Because
CVS bought everything, yeah.
Is that what happened?
Pretty much, yeah, everyone is under CVS. It's a very big drug plan this year. So they put out like 10 different drug plans, mail order, and you just can't beat the price. There's a lot of competition for these little drug companies. Yep, definitely.
And you said the Medicare supplement plan covers you if you travel in, say, the United States or maybe even internationally.
Correct,
Does
all
that
of them
imply that
do.
The Advantage plan does not provide that coverage?
Correct.
It's confined to New York State?
No, some of them you could travel with. The PPOs you could travel. You have to let the PPO know when you're leaving the state and what state you're going to, and they'll tell you if they participate in that state or not. And each plan has different states they participate with. Where original Medicare, it's every state, Puerto Rico, and with a supplement you have foreign travel coverage also. So, they do a side-by-side comparison. Again, this is in the handouts of a supplement plan compared to an Advantage plan. So really, I saw your hand. The main thing is, the Advantage is that it's one card. Often you don't have a premium, they're very low. It provides the benefits of original Medicare, so you're going to get the doctors and the hospitals. It has the drugs built into it. It does have a provider network, charging a plan premium. Some of them do, some of them don't. You'll have co-pays and co-insurances. You'll have an annual maximum out of pocket of $6,700 in an Advantage plan, and it's an all-in-one plan. With a supplement plan, it pays some of the costs not paid by original Medicare. You do not get help with drugs. In addition, you have to pick up a drug plan. It's nationwide coverage. You do have a monthly plan premium starting at $69, going up to $308. The drug plan premium and other cost is coverage that it has to be added. The out-of-pocket, your expenses depend on what letter you pick. And you'll have multiple cards, so it's not just one card. You'll carry 3 cards if you have a supplement plan. So when can I enroll? When you are turning 65, if you have employer coverage, you could keep your employer coverage and not have to enroll. You'll probably just get automatically in the mail a Part A. You don't have to enroll in Part B and be subject to the $135.50 if you have an employer plan, unless your employer asks you to join Part B, and it's usually because you have under 50 employers in the plan. So a lot of people just join A and B and say, well, no, I'm still working. It's not necessary to join B if you're still working. Just check with your human resource department. Before you turn 65, 3 months before, you can, if you're not collecting Social Security, you could log on to Medicare.gov and click the link, I want to enroll in Medicare Part A and Part B. If you're collecting Social Security already, you're going to be automatically mailed a card. So you have 3 months before you turn 65, the month you turn 65, and 3 months after without incurring any penalties when you're brand new to Medicare. You have a general enrollment period for those who missed and said, I never joined A and B, I just, I wasn't paying attention, I have no insurance, I stayed with the affordable health care and paid $1,000 a month, not realizing I even had the benefits of Medicare, and I see this. You're locked out of A and B until July 1st, and you'll get a penalty, so you could then enroll, and it would start in July. Then there's your Medicare supplement open enrollment in New York. You could join a supplement plan anytime you want and change anytime you want without any Medicare underwriting. And there's a special enrollment period for those who delayed enrollment or they're leaving their employer. So once you leave your employer coverage, you can enroll in A and B. You have 8 months to do it without a penalty. But if you don't enroll in a drug plan in 63 days, you'll get a penalty. So I tell everybody, if you're walking away from employer coverage, don't look at the 8-month window. In 63 days, you want to go right from one coverage into a next. Don't let that lapse. 2 months is your maximum to be without insurance. And you have 2 months from the day you walk away from employment to enroll without any penalty and get right into it. You have to fill out a form when you leave employer coverage saying, I turned 65, whatever, 5 years ago. You have to fill it out, and your employer has to fill it out to say, when this person turned 65, we were giving them credible coverage. You walk it into the Social Security office, and you'll get no penalty. So the penalty incurs when you went without nothing. You never enrolled in anything. So when can I change my coverage? We are in it right now. So from October 15th to December 7th, now's the time to say, I'm happy with my drug plan. I love it. I want to stay where it is. Even if you love what you have, check that you're in the right place for 2020. Don't assume that everything's going to stay the same, because it all does change every year. And then again, they added this new Medicare Advantage open enrollment. So January, February, and March, they're making it available to go into an Advantage plan, actually out of an Advantage plan, or switch your Advantage plan if you're not happy with what you chose before December 7th. So that is new. And the special enrollment period, when you have 63 days without a penalty, is if you moved out of the planned service area, you move within a planned service area, and you have new options. When you leave health care coverage from an employer, if you qualify for a special needs plan, if you move in and out of an institution or a nursing home, you instantly qualify. If you get any financial help with Medicare, and if you're out of the country and you move back into the United States, you're in what they call a special enrollment period. You have 63 days to change your plan. How could I save money? I can't stress enough the EPIC. It's a wonderful pharmaceutical assistance program. You want to use the preventative services. A lot of people don't realize that Medicare has preventative services covered now. So if you get the Medicare and You book, on page 48 and 49, it's called the Welcome to Medicare and your yearly wellness visit, and anything with an apple next to it, you'll get at no cost to you on original Medicare. It's your flu shot, your cancer screenings, your bone mass measurement, and you just need to let your doctor know, I'm brand new to Medicare, I want my Welcome to Medicare physical. If you don't say that and it's not coded that way, you get billed. So you have to say, I'm new to Medicare, and then yearly, every year, you call and say, this is my annual wellness visit. Please code it that way, and there's no cost to you. So they figured out that if they provide preventative services, people stay healthier. Another way of saving money is ask for generic drugs, low-tier drugs, stay out of the donut hole, stay in the provider network, use the plan's preferred or mail order pharmacy. That's another thing about the small pharmacies. The mail order will mail you right to your front door, 90-day for tier 1 and tier 2, free, and for a couple of dollars. So the mail order has gotten tremendous, so that there's no need to even walk into the pharmacy. And the savings is most of the time 50% savings. And understand your status in the hospital. You want to ask when you're on Medicare, am I admitted or am I being observed? Because if you're on original Medicare and they admit you, it's a $1,364 deductible. So you want to know your numbers with that too. In the books, when you walk out, take a blue book. These phone numbers are in the books that I'm handing out. It's a SHIP phone number, and it's for financial assistance and programs that are being offered in Suffolk County for low income. Depending on your income, you can get that Medicare Part B, that $135.50 put back into your Social Security check. I do have the guidelines here if you want to see what the numbers are. And where can you get help? This presentation is called Medicare Made Clear. Again, call me if you want to just, figure out numbers, pick my brain. You're not sure about if you're going to get a penalty. I'm here to answer any of the patrons of the library. Call me. There's no obligation for anything. There's no cost. I'm here often educating on Medicare. That's Education Week. And then Medicare.gov. It's a wonderful resource. They actually have updated the website. There's a little search bar on Medicare.gov. You type your question in, and pretty much it brings you to the link to answer the questions you might have about what's covered and what's not covered. So I thank you, and are there any questions? Yes?
You said something about low income. Is there a certain amount of money if you only make, say, $30,000 after you're 65? Is a special program? My friend in Vermont has that.
Yes. So this year, the numbers for low income to get the $135.50 put back into your Medicare check. If your income and you file single is under $1,386 a month, you could fill out the application. If you file joint, the income has to be under $1,800. If your income a month, if your income is that low, they will put you as a qualified individual and put the $135.50 back into your.
But how about the supplemental insurance? She doesn't pay anything for that in Vermont. She doesn't pay.
Oh, are we talking out of state?
In Vermont, yeah.
Oh, you can't compare Suffolk County with anything. We're all in the most expensive county in the United States. You can go to Vermont and get everything for nothing. It's like all where you are. There's no. Every state, every county puts different prices on everything. So yeah, you can't even compare out of state to New York, Suffolk County. When you move, you're in a special enrollment period. You contact Medicare and say, I left, what drug plan? But your supplement plan, if you picked one of those letters, A through N, that travels with you. Yeah, that travels with you. So, were there any other questions? Yes.
In general, option 1 is more expensive than option 2. Is that why people choose the limited?
The premiums are, but not the maximum out of pocket if you use the plan. You save more money. It depends on how you look at insurance. If you look at insurance as, well, what would be my maximum exposure? More people find option 1 is less than, God forbid, XYZ diagnosed with. In option 2, you have more out-of-pocket expenses. But in a perfectly healthy year, option 2 has lower premiums. They're free. So.
If you make more than a certain amount of money, you're paying
higher premiums, right?
Absolutely. For Medicare Part B and for your Medicare Part D, correct. Yep, yes.
The Veterans Advantage that you had,
Yes.
you mentioned, what you have to show in order, and are you saying that you actually get your Part D charges put back? In effect, are you getting Part D?
Not to be a veteran. The only benefit with the veterans is if you had a late penalty and you're a veteran, they'll excuse it.
Okay.
The only way to get the Part B benefits back into your Social Security check is low income. And the income, when you're filing joint, a married couple has to be under $1,800 a month. Yes?
How is that $135 paid for? You said in-
It comes automatically out of your Social Security check. If you're not collecting Social Security, they bill you Medicare Part B quarterly,
Oh.
and you have to pay, set it up with a credit card or a bank account. So I thank you all for coming out tonight. If you have any further questions or want to pick my brain about anything, I do have business cards. You're more than welcome to call me at any time, and it's been a pleasure. Thank you all for coming out tonight.